Again, we want to thank you for joining us for this week's Community Leader Call with the district's response on coronavirus, COVID-19. Today we'll be joined by the Director of the D.C. Department of Health, Dr. LaQuandra Nesbitt, as well as the Director of the district's Homeland Security and Emergency Management Agency, Dr. Christopher Rodriguez, and I am Smas Salamonte, Deputy Chief of Staff to Mayor Bowser. Before we get started, I want to remind everyone, if you have a question for our speakers, you can press 0 now to be entered into the question queue, or you can, if you have any additional questions as we move through the call, you can press 0 at any time to be entered into the question queue. But that is how we will be able to answer your questions and get any feedback for you all, or anything you want to flag for us. You can do that by pressing 0. I do want to remind everyone, again, coronavirus.dc.gov is the best place for all of the most up-to-date information and resources related to the district's response and recovery efforts on COVID-19. As you all know, we have recently announced 2 new mayor's orders this past week. The first, the mayor announced on Monday a mayor's order on travel and self-quarantining that went into effect on Monday the mayor's order on travel and self-quarantining went into effect. We released the list of states that the DC Health has classified as high risk that are available on coronavirus.dc.gov. So please make sure that you look at those high risk states. And again, we will be updating those states every 2 weeks. So our next update on that list will be August 10th. And we want, we want to ensure that people are not doing unnecessary travel. But if you are going to be traveling, before traveling, be mindful of the risks and requirements and look at those lists. Now is not the time to be traveling to states where the virus is circulating and where you are more likely to be exposed, infected, and then bring it back to D.C. and infect others. And again, if you do travel at a high-risk state for non-essential travel, such as for vacation, you will then, when you return, you must self-quarantine for 14 days. If your travel is essential, then you must monitor yourself for symptoms and limit your activities for 14 days. Example of essential travels include traveling for essential government functions or essential business, traveling to care for minors, elderly, or dependents, or travel required by law enforcement or a court order. We know that, in the midst of summer, this is not easy, but we all have a role to play in making sure that that the safety measures we've implemented at the recommendation of the D.C. Department of Health can be effective, and that we are not undermining our efforts to keep our fellow Washingtonians safe and do everything we can to flatten the curve here in the district. So before we go into questions, I just want to remind everyone again that list of states related to the quarantine order are available on coronavirus.dc.gov. We also have, as you know, last week we released a mask order where you're required to wear a mask when in public, when you're going to be within 6 feet of any individuals outside of your household. So the more information related to the mask order is available on our website. And then before we go into Q&A, I just want to remind everyone, Mayor Bowser has recently, non-COVID related, but want to get this out there right away before we go into Q&A. Mayor Bowser recently announced the District of Columbia Facilities and Commemorative Expressions DC Faces Task Force, which is charged with reviewing the legacy of namesakes of the district assets, including statues, etc., building names. The working group will make sure to be reviewing all of these and will provide recommended actions, including removing, renaming, or any buildings or monuments that may be in conflict with our DC values. We are always looking for ideas and suggestions on this. So we have launched a survey, and we highly recommend that you go and complete the survey. That survey is available at mayor.dc.gov/DCFaces. Again, that survey is available at mayor.dc.gov/DCFaces. So before we go into Q&A, I was going to see Dr. Nesbitt or Dr. Rodriguez, if you all had any points you wanted to make prior to us going into Q&A.
Sure, Tomas. I just want to make sure that we emphasize the importance of the travel and quarantine mayor's order that was put into place last week. And as we have had the opportunity to engage with district residents about this, and as some people have emphasized and highlighted that, believing that the intent of this is to focus on residents from those states coming to the district for tourist-like activities. We want to make sure that our residents understand that we, as you have highlighted, want them to understand that it's equally important that they be mindful of our emphasis on them not traveling to those locations for non-essential activities such as vacations and work conferences that are not essential, sports tournaments, things of that nature. What we have observed is that we are seeing more people become positive for COVID-19 within 2 weeks of having traveled to these locations, and this contributes substantially to the spread of the virus across the country, which is why it was necessary for us to take these actions. We also want people to be mindful that you may travel to an area that is an emerging high-risk state, and while you are on travel to that high-risk state, when we post our new list every 2 weeks on a Monday, that state may now be on that list, which means that as you return, you may have to be subject to the 14-day self-quarantine. So it is truly essential that we be mindful of the activities that we participate in. We choose our activities wisely, and that we take our shared responsibility to reduce the risk of transmission of COVID-19 very seriously. I'm back.
Thank you, Dr. Nesbitt. So we will now go into Q&A. I want to remind everyone, if you have a question for us, to press 0 now, and you'll be entered into the question queue. We're going to go first to Ann Romig in Warren 3. Ann, your line is unmuted.
Yes, my question is, what is the policy about bars? Are bars open?
Bars in the District of Columbia are closed. Bars in the District of Columbia have been closed for several weeks or months now. They have not been permitted to open. We also require that restaurants that have a bar area not serve seated patrons at that bar. So what that means is that if you go to a restaurant and they have an area that is a bar area, you should expect to see one of two things. If they choose to use the bar area for seating patrons, then the patrons can be seated there, but no one can be tending the bar. There cannot be an active bartender serving patrons if people are seated there 6 feet apart. So the area could be used, and a waitress or a server can come over and take people's order and walk away, and then bring their food and walk away, but a bartender cannot stand there serving people drinks. If a area is not used for seating, then a bartender can use the area and prepare drinks while wait staff come and pick up those drinks and take them to tables. But bar areas and bars and nightclubs are not open. In addition, patrons cannot go to a restaurant and stand and be served alcohol. If any of these things are happening at a restaurant, it should be reported to DC Health or ABRA, the Alcohol and Beverage Regulatory Agency in the district, and we will go out and make enforcement actions immediately. The other thing to note is that nightclubs and lounges are not permitted to be open unless they are open as a restaurant that serves food.
Thank you, Dr. Nesbitt. We'll go next to, before we go next, I just want to remind everyone, as Dr. Nesbitt said, all of our guidances for how restaurants and other industries can be operating safely if they are able to open in phase 2 and operate in phase 2, those are all posted at coronavirus.dc.gov/phase 2. So I just want to make sure everyone is reminded where those live and exist, and highly encourage everyone to familiarize themselves with the guidances that are from DC Health. Next, we'll go to Jean Purchase in Ward 1. Jean, your line is unmuted.
Oh, yes, good afternoon. I want to thank the mayor for all she has done and Dr. Nesbitt for all they've done and whoever to help us stay safe. However, my concern, number one, is when schools open up universities or whatever. If students and educators are coming from at-risk states, how is that going to be controlled? Because, they're at-risk states. We've tried to keep our numbers down and stay, quarantine, and so what is going to be done to control that? Number two, educators. I'm a retired educator, and I'm tired of hearing them say students are first. Students are first for me in my classroom, but students cannot get in a building before I do and in my classroom first. I have to get in there first. Then they come in. So they're first, but first squared. So therefore, what is being done, and I repeat, I'm retired, so it's not to do with me and money, but what is being done to try to see that educators have, number one, a computer given to them, because if you give the students computers, but educators aren't giving them computers, so they had one at home, so their children are on it all the time, or their children don't get to use it, then how is the teacher going to do her work if she only had one or he only had one?
I think we just lost Jean. Dr. Nesbitt, if we want to start with question one on Jean's question.
Yep. This is Chris Rodriguez. I can take the question, Tomas. So thank you very much for the question. I'll start with the first question first, which is about universities and colleges and some of the concern I think you expressed about students coming from other states and hotspots. Mayor Bowser and her team have met with each of the university and college presidents in the district over the last several weeks, and each of the universities was required to submit reopening plans to the DC Department of Health, Homeland Security, as well as the Office of Planning, and those reopening plans were reviewed, edited, and sent back to the universities to be incorporated. And the mayor was very adamant about ensuring that students who are coming from those hotspots across the country or the universities needed to have plans in place for them to self-quarantine for 14 days. And as you know, some of our universities have decided to go all virtual for the fall, so in that case, self-quarantine wouldn't apply for students. But the ones that will be doing a hybrid approach or having some in-person learning are required to submit plans to the district for us to accept for self-quarantine from hotspots. On the second question on the teachers and schools, should the mayor and DCPS and Deputy Mayor for Education decide to do in-person learning for the fall or for part of the fall? In leading up to those decisions, and certainly over the last several months since the schools went all virtual, they have been planning with the teachers unions, and making sure that there was a variety of stakeholders, not just teachers, but also parents, students, send out various surveys. The chancellor has had multiple town halls, not just with teachers, but with families as well, to make sure that, again, in the event there was in-person learning, that teachers would have everything they need, students would have everything they need. So that planning has been ongoing, and it will continue throughout the school year.
Thank you, Dr. Rodriguez. We're going to go next to Jacqueline Mears. Jacqueline, your line is unmuted.
Thank you. I would like to ask the status of our preparedness with contact tracers. Do we have enough? And how will we be able to expand to meet the requirements as we are able to hopefully phase out of all of this?
Hi, yes, thank you for the question. We have more than a sufficient number of contact tracers under our employ right now at DC Health, as well as a sufficient number of applications on hand to hire additional contact tracers as needed. In addition to that, a number of district government employees have completed training and can be rapidly deployed to assist if we were to have an emergent need to add more contact tracers to our contact trace force.
Thank you, Dr. Nesbitt. We're next going to go to Pandora in Ward 7. Pandora, your line is unmuted.
Hello? Hi, good afternoon, and thank you so much, Mayor Bowser and her team. My question is that, we've been trying to keep D.C. safe. How about our family members that are traveling to us from, like, Florida and South Carolina? How do we actually protect ourselves? What type of guidelines are out there? What should we do?
So I think it goes back to the top of our discussion where we know it's the summer months and we're used to traveling and having vacations, but we're still in a pandemic. And we should think very strongly about the reasons why we are having visitors, and particularly visitors from high-risk states and high-risk areas. And so we would ask people to think very strongly as to whether or not it is prudent at this time to entertain guests, especially guests in our home from high-risk areas where they may have a high risk of exposure and may be putting yourselves and family members at risk, especially if you have members of vulnerable populations in your home, elderly individuals over age of 65, anybody with a chronic health condition. Inviting your family members or friends who live in high-risk states to visit you at this time may not be the best decision for yourselves and your family members. So just as we're asking district residents to not visit those locations for non-essential reasons and return to the district, we would ask you to think about the need to extend invitations for them to visit for non-essential reasons. If they do visit from those high-risk states, they are to self-quarantine at whatever location they are staying. If they're coming and they're staying in a hotel, they need to stay in that hotel for 14 days and not leave the hotel for any reason other than food or medical care. If they're staying in a private residence, they need to stay in that private residence and not leave that private residence for any reason other than food or medical care. So the visit would not necessarily be very social in nature because we would not expect that they would be participating in any social activities such as going for outdoor dining, visiting other people's homes, etc. So if they live in a high-risk state, they would not be coming to the district to visit any of our museums, go to any of our restaurants, or do any social activities at this time until they have spent 14 days in self-quarantine.
Thank you, Dr. Nesbitt. We're going to go next to Felicia Niles from Ward 8. Felicia, your line is unmuted.
Yes, hi. Actually, Dr. Nesbitt actually just answered the question, but I do have another one. I have been trying to get tested to see if I'm asymptomatic. I did the COVID-19 test when they were doing free testing, and that came back negative. Do you have any idea when we will be able to find out whether a person is asymptomatic with the COVID-19?
So what it means to have COVID-19 and to be asymptomatic is that a person has zero symptoms, meaning you have no cough, no fever, no shortness of breath, no headache, no body ache, no vomiting, no headache, none of the long list of symptoms that have come to be identified with COVID-19, and you have a positive test. So when we say that people are asymptomatic and COVID-19 positive, that's what we mean. So anyone who is asymptomatic with COVID-19 has had a test, the test is positive, and they have zero symptoms. So that's what that means. So we have people who are asymptomatic who go for a test. We don't recommend that everyone who is asymptomatic go for a test. We recommend that people who have a close contact exposure, which means that you have been in close contact with someone who is known to have the virus for at least 15 minutes and you've been within 6 feet of them, that's who we recommend in terms of asymptomatic individuals go to be tested. People who do not have a high-risk exposure, who don't have any symptoms, we don't recommend that those individuals just up and go get tested. We don't have that broad recommendation at this time.
Thank you, Dr. Nesbitt. We have time for just a few more questions. So I want to remind everyone, press 0 if you have a question. We have time for just 2 more. So we're going to go next to Jillian Hess in Ward 5. Jillian, your line is unmuted.
Yes, hello. I saw yesterday that the mayor had tweeted that there was a coronavirus testing site at Union Station from 10 a.m. till 4 p.m. I'm wondering where exactly outside Union Station that site was, and I would like to know also if there is going to be a recurring testing site at Union Station, and if so, on what days, please.
Weekly, we post all of the testing locations for the week on coronavirus.dc.gov under the testing tab. So all of the publicly supported testing sites are located there. We also encourage people to call their healthcare provider for any other opportunities to be tested for COVID-19. It's really important for people to know that COVID-19 testing is covered by your insurance. So given that we know that most district residents have health insurance, the testing is free through your insurance and free at your healthcare provider as well. Last week, we had inclement weather on a number of days, or I should call weather disturbances, because I quite enjoy the hot weather, so I didn't consider that to be inclement. But we had a number of days where we had thunderstorms that required us to have to close some of our walk-up testing sites at firehouses. We want to make sure that everyone on this call and that you can communicate this to your neighbors. You know that your doctor's offices, your regular health care providers, and urgent care centers across the district also offer testing for COVID-19. So you don't have to wait and rely solely on the public testing sites that we advertise on coronavirus.dc.gov under the testing tab to receive a test for COVID-19. There are other options that you can pursue, and your doctor's office knows about those. Come on.
Thank you. Thank you, Dr. Nesbitt. We're going to go next to Philip Bender from Ward 2. Philip, the line is unmuted.
Hello. I want to thank the mayor for all that she does to keep us safe and to make this a wonderful place to live. My question is, I live in a condo with a number of units, and residents buy and sell and move in and out, and we've had a problem. Even though we have signs posted all over the building and in the elevators, we have a problem sometimes with movers, paid movers that are moving furniture in or out of the building, and they refuse to put on masks. And I'm wondering what we can do about that. Can we call the police, or what should we do? Thank you.
This is Chris Rodriguez. I was on mute. So we appreciate that concern. We've heard it from other condo associations. So what we recommend is, and certainly the mayor has been very explicit about ensuring that there is widespread knowledge of our new mask mandate or the mask order. And put simply, when you go outside, you should wear a mask. And if the folks on the line haven't read the order, I would definitely encourage you to. It's at coronavirus.dc.gov. So we want to first encourage people to wear masks, and I would say for any movers that are coming into your condo, they should be encouraged to wear masks. The second is that if you see repeated violations of that order and of that requirement, I would certainly report that to your property manager and to the property management for the condo. And again, if you do not feel like you are getting the response that you need, you can definitely let the DC Department of Health know about that. And once again, you can find that information at coronavirus.dc.gov. Thanks, Tomas.
Thank you, Dr. Rodriguez. Well, that's all the time we have for today's call. So we want to thank Dr. Nesbitt and Dr. Rodriguez for being on to help answer questions. Again, I want to remind everyone for the most up-to-date information and resources related to the district's response to coronavirus COVID-19, please visit coronavirus.dc.gov, where we'll have all of our most up-to-date information there. Also, tomorrow the mayor will be hosting her daily her press conference for tomorrow at 11 a.m. So we hope that you'll tune in to join us on the mayor's social media platforms as well as GCN Channel 16. And we will have additional updates for you all there. So we hope you'll tune in. That's again tomorrow at 11. So again, thank you so much for joining us, and we'll see you next Wednesday at 5 o'clock for our weekly community leader call. Thank you.